People with CF need transportation for many different reasons. Getting to CF clinic appointments, picking up medications, and shopping for nutritious food are a few essential parts of managing your health, but there can be challenges. The expense and time needed to travel to a CF care center can make necessary medical appointments unaffordable. The cost of gas, parking, and maintaining your vehicle so you have a reliable way to get to your clinic visit. The distance to the CF care center, or not being able to drive or get a ride, means traveling might be difficult. These are just a few examples of costs that can add up. Public transportation, such as a bus or train, can also be tough if you don't have access or have concerns about using it. Here's how a couple people with CF describe what they've experienced. A few weeks ago, I was going to my doctor and my car was totaled. I'm now afraid of driving into the city. My CF team is 2 hours away in a hard-to-get-to area. Then the cost of parking and the gas. You don't want to go if you don't have to because it costs so much money. I live 100 miles from my CF clinic, so it's an all-day event when I have to go. I'm hoping to get some financial help through some nonprofits since I'm on disability and will quickly burn through my money traveling to my clinic. Lack of transportation can mean missed appointments and delayed care, which may lead to worse health outcomes. If transportation challenges affect your ability to get the care you need, know that you are not alone. There may be resources to help. You can start by talking to your care team or hospital to learn if they offer support such as gas cards, parking validation, or have partnerships with community programs. Some hospitals offer free transportation within a certain area. Then look for programs in your community, county, and state, such as transportation provided by networks of volunteers or discounted services. Connect with your CF care team if you're unsure how to learn more about these possible resources or if you're not sure if you are eligible. Every care team is different, but here's how a couple teams are helping people with CF navigate transportation challenges. I found it important to ask all patients and families if access to transportation and the cost associated with getting to and from the hospital impacts their ability to get to CF clinic. Another CF provider said, "If transportation challenges are going to keep my patient from attending their appointment, I want them to feel comfortable sharing that with me ahead of time. We may be able to work together to see if a telehealth visit is an appropriate option." You can also check with your health insurance plan about non-emergency medical transportation, called NEMT. Some plans will pay for transportation to and from medical appointments and pharmacies, sometimes other trips too, like for groceries or exercise. Some key words to use when talking with your insurance plan include travel benefits, value-added services, supplemental benefits, transportation assistance, and non-emergency medical transportation. CF Foundation Compass can help you understand what's covered under your current plan. Not all health insurance plans offer NEMT benefits. When they do, some plans provide transportation while others provide mileage reimbursement. If you have Medicaid as primary or secondary insurance, you'll likely receive some NEMT coverage because it's a core benefit required by law. Some states offer expanded transportation benefits through Medicaid waiver programs for chronic or special needs populations. Some Medicare Advantage plans may include NEMT, such as trips to the doctor or pharmacy. To find out what is available specifically for you, you must contact your health insurance plan. If you are eligible for transportation services through your insurance plan or other programs, there are a few things to keep in mind. For example, you often have to request service several days in advance, and the companies who arrange transportation often only can handle certain geographic areas. Additional logistics to figure out include timing for your drop-off and pickup, who can go with you to your appointment, what devices you need to take, and whether you will be sharing your ride with others using the service. When you can, you'll want to give yourself plenty of time to book your ride and may want to call again just to reconfirm. If you need help, talk to your CF care team, or you can contact us at the CF Foundation, where Compass case managers like me are here to help every step of the way.